Can everyone, Richard, can you see my screen?
I can.
You can. Okay, beautiful. All right. Want to welcome everybody to another edition of Public Leadership Institute's online training series. This policy leadership session is going to be focused on a topic that is very timely. Maybe not as timely as the other one that broke in the last 36 hours, but it's certainly timely as it relates to discussion around healthcare in this country. And efforts underway in Washington to dismantle the Affordable Care Act. And we've got a very esteemed colleague, an expert in the field to really take us through some of the messaging and conversations and how we all can take an active role, especially in these coming hours, days, weeks, and months while the Senate prepares to re-engage on this topic. My name is Dave Woodward. I am the National Network Director with Public Leadership Institute, and in addition to that role, a county commissioner, former state legislator, and I'm going to be your host this afternoon as we engage in this topic. I want to kick off a couple housekeeping matters before I hand it over to our expert to lead us in this conversation today. We have, for those who are joining us for the very first time, Public Leadership Institute is a nonprofit, nonpartisan leadership center that's really focused on bringing attention to a host of key issues around equity and justice, and working with public leaders to be more effective in advancing and improving the economic conditions for all people across this country. To that end, and for some reason on this slide, one of our publications just vanished, but if you go to our website, www.publicleadershipinstitute.org, you've got a host of publications that you can download, everything ranging from the most recent progressive agenda, outlining tons and tons of policy ideas that can be advanced at the local and state level, with hyperlinks to model legislation and resources to help support you in that effort. Folks have heard us talk about, and a lot of the sessions that we do on our webinars come out of our Voicing Our Values publication. There is a brand new edition that's available on our website that I encourage you to look at, and if you would like a hard copy, either contact our office or go directly to Amazon and you can purchase a copy. We've got other publications, and one other I just want to bring attention to that you see on the screen, Preparing to Win, which is a guide for successful advocacy to really bring these ideas. And so it's a resource that I encourage you all to go to. You can go to access it through our website. I think it's incredibly timely as we talk about a topic, not only how to talk about healthcare and particularly specifically how best to argue against the conversation that's happening in Congress right now, but becomes a tool that you might be able to use to advance a campaign to, not just protect healthcare, but strengthen healthcare and other topics moving forward. There's one of the other publications here. Given the topic of this, and since we're going to be talking around best practices around arguing against the federal health care legislation being debated right now, we really do want to create the space to give all of you an opportunity to test language, ask questions, share, give reaction, and share comments as we're going through the presentation today. And to that end, we've got a number of ways you can be part of that conversation. If you're joining us from an ability where you have audio capabilities, please click on the hand icon on your control panel, your go-to webinar control panel, and at any time during the course of this presentation, or when we pause for questions, we can unmute you and bring you into the conversation. We do realize that people join us from a variety of locations, and sometimes audio is not available. You can type questions in the question bar, and we'll try to take as many of those as time allows. You can always email me at dwoodward@publicleadershipinstitute.org after today's session. If you have any questions, definitely we'll put you in contact with our guests this afternoon. But please take us up on really using this opportunity to not only talk with an expert, but really really help enhance this experience while we're all gathered around the country this afternoon. And without any further ado, let me introduce our guest speaker. Richard Kirsch is a former senior fellow at the Roosevelt Institute and the author of Fighting for Our Healthcare, the Epic Battle to Make Healthcare a Right in the United States. That was published not too long ago by the Rockefeller Institute Press. Prior to joining the Institute, Richard Kirsch was the National Campaign Manager for Healthcare for America. Many people might know it more as Healthcare for America now, but a lot of people might know it as HCAN. It was the campaign founding that led in the successful conclusion that created the Affordable Care Act. HCAN is a 1,100 member 1,100 member coalition around the country that has really been a major progressive champion that not only deployed staff in 44 states and spent nearly $50 million organizing for comprehensive health care. As a chief spokesperson, Mr. Kirsch has appeared on PBS's NewsHour with Jim Lehrer, CNN, ABC, World News Tonight, and Good Morning America, Fox, C-SPAN, the Colbert Report, the New York Times, Washington Post, Wall Street Journal, you name it. Richard Kirsch has been on it because not only is he an expert communicator, but an expert in this field. Prior to a lot of this work, I served as executive director of Citizen Action of New York, a grassroots organization of 20,000 members leading progressive policy change there. I mean, the list literally goes on and on in terms of he's a good friend of the Public Leadership Institute. And without any further ado, I want to welcome Richard to activists all around the country. He's anxious to hear what we're going to talk about today.
Thanks, Dave. Can you all hear me?
We can hear you, and yep, and I'm about, yep, I'm gonna hand things over to you right now.
Great, and you should see as of now, you should see the slide from the beginning of my slideshow.
Perfect.
So, thanks, Dave. Appreciate it. Thank you for the introduction. What I'm doing now is I run a project called Our Story, the Hub for American Narratives. And the purpose of this is to build the capacity amongst the progressive infrastructure, elected officials, organizations of all sorts, to use narrative to really promote, belief and understanding of progressive American values and core beliefs. Why do we need to do this? I always love this quote from President Lincoln. The rest of the quote goes on to say, he who controls public sentiment makes legislation, elections possible. The theory behind this is that for all the work we do in the day-to-day work of politics and legislation or litigation, and in the organizations we build, the way we engage in politics, we swim in an ocean of what's the cultural common sense, what's the predominant worldview, and if we can't shape that, we're in trouble. We need to shape that so that people understand our core values and how we believe the world works and what we believe. And so that's why, for me, narrative is a value-based story about our core beliefs. Our core beliefs is what we're trying to change here. We're trying to express, people understand. It's what we really do believe. That's the power. But powerful communication is based on values, which is how we morally organize the world. It's based on story, heroes, and the quest, and villains they're trying to vanquish to get the quest, and that's how we actually organize. And so we want to have narratives, policy narratives, which do that. Here's an example of two very short policy narratives with very, very different stories about who's at fault and what the problem is and what we value in just the shortest terms. The other thing, as well as values and story, is repetition. This is something that I think progressives are not nearly good enough about. We need to repeat what we say over and over again, and then we need to repeat what we say over and over again. And it's why you see the same ad 100 times. It actually creates new neurons, makes things more believable. the messages I'm going to have here are pretty brief because most of them will say the same thing over and over again. Finally, I just want to give folks a sense. A lot of the work that I've done with Public Leadership Institute. Dave's a proud graduate and uses in his position as county commissioner and with his colleagues a training tool that I use to help people have a powerful economic narrative that connects so that you all are all speaking with the same voice in a way that's really effective. This is just a brief summary of it. I'm going to get to healthcare, but mostly what I wanted to, it's an advertisement to say that what I love doing is working with elected officials about how we can tell a powerful story about how we create an America that works for all of us, not just the wealthy, and how we can do that together, how working families, the middle class, the economy, and the real question for government is not whether it's big or small, but whether it works for working people in the middle class. So those of you who are more interested in that, there's a website called ourstoryhub.org. You'll see that at the end, and I'm glad to talk to you about it. So let's get into health care. So the Republicans are now running into the same buzzsaw that Democrats have run into for more than 100 years of trying to get health care passed and not being able to. This is an issue that's more personal than any single issue that you will work on as a state policymaker. And because of that, people pay attention to it in a way that they do no other, and it's very easy to scare people. And then there's this concept which the, I don't know, the sociologists, psychologists, whoever call loss aversion, which basically say that, you know, we're much more worried about losing something than gaining something we don't have. And so the conservatives have stopped, and business interests have stopped healthcare for years, scaring people they lose what they have, even when that wasn't true. But Republicans are actually really trying to take something away from people, really. And so that's why we're seeing such an angry, angry response. And the other thing in healthcare that's really interesting is that people can say there's a problem. So in the case of the Affordable Care Act, Republicans have made a big deal about high premiums and deductibles, which actually were not caused by the ACA, but were helped a little bit and then not so much. But once you actually get to the solution, which in this case repealing and the half-assed replacement, you have real problems because people focus on what that's going to mean in their lives. And it's why that a big reason we got the Affordable Care Act passed is that it changed as little as possible. That's why the president, we also said, if you like your health care, you can keep it. We should have said, if you like your health care and it's good health care, you can keep it. That would have been we should have said. But the point is, the other side here is trying to take health care away from people, and that's very painful. And so much so that it's extraordinarily unpopular in every state, even among Republicans, even though they still support repeal. And this guy's in Utah talking to Representative Jason Chavins, who's now retiring. So it's unpopular every place, even in the reddest states in the country. So what do we say? We focus on one other thing. Big observation here, which for me is really interesting. We're actually winning the broader narrative war. We're fighting this on our terms, which is that government does have a responsibility to provide health coverage. The president said that, and even said they should negotiate lower drug prices, a totally anti-free market thing. He doesn't mean it, he's not doing it, but you know him, rhetorically, he says things which he gets people like, even if his actual policy is to totally favor the rich and big corporations. Republicans are promising to have to keep covering pre-existing conditions when they back away from it, hugely unpopular. Again, rolling, and all the things they're doing which take government regulations away are incredibly unpopular, as are Medicaid cuts. Medicaid is incredibly unpopular. And so the right's reduced to saying this is Obamacare light, because it is, which is to say whatever they pass will still have a role for government. And so it's great we're winning this narrative war. But how are we winning it? What are we saying? More than any other issue I've worked on, you just basically have to explain what it does. A lot of times it's really important to have a values frame because people have trouble understanding policies. And so healthcare is a little bit different. As I said, it's so personal. People pay more attention to policies. So the core message is the Republican healthcare bill takes coverage away from 22 million Americans, slashes Medicaid, hikes your premiums and deductibles, and allow insurance companies to charge thousands of dollars or more to people with pre-existing conditions, all to give huge tax breaks to the wealthy and drug and insurance corporations. And that's got a lot in there, and people absorb different parts of it, but they get it. And the kicker on the motivation is really important, because why would they do that? Oh, to give huge tax breaks to the wealthy and drug insurance corporations. And it is a major reason they're doing it. So that is the core message. And if you say nothing else, you can say that. But it's great to add a values punch. One of these lines. Their plan will mean that more people will go without medical treatment and more will die. It's unacceptable to anyone who values human life, and will make it even more difficult for Americans to care for and support our families. Add all three of them. That will then deepen, recognize, push. And frankly, you could say just that. And if you had 30 seconds, just say these two slides, and you'd be done, and you'd be in great shape perfectly. Let's go through these a little more and add some other things, because you may want to talk more than this, and you may actually understand how it does these things. And again, these slides will all be available to you after the presentation, so you don't have to take notes. You get them all there. You just listen. So, as state legislators, we want to focus a lot on the impact on Medicaid, on jobs, and hospitals and community health centers. And the plan really does make radical changes, deep permanent cuts to Medicaid. It's going to wreck state budgets, but huge holes, force enormous cuts in either healthcare or education, and really both, because you can't just do one. And it's going to jeopardize jobs of millions of our state's healthcare providers. Many of our hospitals and community centers are going to cut back services. Others, particularly in rural areas, will close. And for states dealing with health emergencies like the opioid crisis or others in the future, these huge radical cuts to Medicaid will make it impossible to respond. So, as I think you all know, the impacts on Medicaid are huge and enormous. But it's people who get Medicaid, it's the hospitals, it's the providers, the communities. How does it take coverage away from 22 million Americans? Now, say Americans, don't say people. Make it clear we're talking about working families, because most adults on Medicaid are either disabled, senior citizens, or working. And there's also 30 million children on Medicaid. So that's who we're talking about. How will it take coverage away from 22 million Americans? Well, the Medicaid expansion, of those of you in states who have done that, is all working families, families who make too much for the basic Medicaid program in most states, but are not earning enough to be on the ACA exchanges. Then if you're on the ACA exchanges, it slashes the tax credits, particularly for moderate income working families, and it hits seniors the hardest. People 50 and over, people 60 and older. They're allowing the insurance companies to charge 5 times as much to seniors than young people. Huge credits. And the amount, there's data, by the way, there's data on all this stuff in your states, and we'll give you links to how to get that at the end of this. And it slashes Medicaid, children, seniors, people with disabilities. So that's, again, takes 22 million, healthcare away from 22 million Americans. Don't say they're going to lose their coverage. Republicans are taking coverage away. You don't lose coverage. It's not like losing your keys. People are taking it away from you. It slashes Medicaid in 2 ways, by 773, I think my slide's covering some of this up, $1 billion. Oh, what happened here? $2 billion in 2 ways. One is the Medicaid expansion we talked about, and 2 is the radical restructuring. Basically, it means that Medicaid's going to only have a certain amount per person, and the rate it's going to go up is going to be much less than medical inflation. In fact, over 20 years, it's going to mean over a 35% cut in Medicaid to states. And again, Medicaid is 74 million Americans, from children to seniors. Surprisingly, we learned from lobbying by the children's hospitals that a lot of Republican congressmen who voted for it thought, oh, children aren't affected, they're all in the CHIP program. No, 30 million children are on Medicaid. So point that, children to seniors. And, half the births in the United States covered by Medicaid, 3/4 of all family services, 60% of long-term care, that's nursing home care, that's home care, that's seniors, it's children, it's mothers, it's working families. It hikes premiums and deductibles. If you're talking to working families who are in the employer market, which is most people in this country, almost half the people who have employer coverage, they're concerned about premiums and deductibles. False idea that somehow ACA, Obamacare, is responsible. for the premium deductibles going up. It's not. It hasn't helped the problem, but it actually hasn't made it worse. But what is true, and this is really important to say, is it will hike by slashing the tax credits of working families. It's going to make premiums and deductibles go way up. And moderate income families and people over 50 are going to pay the most. And if you want to know more about, does that affect me if you're at work? No, well, it will affect you at work in one way, we'll get to. But if you lose your job and needed to get health coverage, this is what it would mean. And deductibles would go up even more because the Republican bill, in order to bring premiums down, pushes plans with much, much higher deductibles. Which means the health insurance companies pay much less of your care. But it doesn't really bring premiums down because of the fact that it slashes the tax credits so much. You still pay way more out of your pocket. Only young people, the youngest people, would actually paying less. But for almost everybody else other than young people, you pay a lot more. And even young people will pay lower premiums but have less coverage for it. And we're talking about bare bones coverage, and you're going to pay more of your pre-existing condition. Republicans may say we're still making insurance companies cover you for pre-existing condition, but both the House and Senate legislation allow states to have waivers to basically sell bare bones insurance without essential health benefits, and that will allow insurance companies to charge people more with pre-existing conditions. Because the insurance companies won't cover certain things and then if you want them, you'll have to pay more. Also, there's bans now on insurance companies saying we're going to stop paying. You spent $100,000 this year, you spent $300,000 in your life, we're going to stop paying. The ACA doesn't allow that, but the way it doesn't allow that is applying it to these 10 essential health benefits. So if a state says we're going to opt out of these benefits, at that point, it also means that the protection for those benefits against lifetime and annual limits is gone. And really, really important here, this includes people with employer coverage. That's mostly who you're going to talk to in the public, because what it allows a company to do is shop around for a state that has done this. So you may say, maybe you're in a state that's not going to do this. You think your state's not going to go along with the waiver. But if a big company in your state decides it wants to, it can shop around and sell its coverage based on the rules in a state that does strip the waiver away. And that will mean that people with employer coverage will lose a lot of protections as well. For seniors and people with disabilities, huge attack through Medicaid, which now, as we said, covers more than 60% of nursing home residents, and allows millions of seniors to live in their homes. And it, as we talked before, raises premiums the most for older working people. For women, women are incredibly, they're the people in the household who pay attention to healthcare, who are the healthcare shoppers, who understand it most, and as well as an attack on their family's health. And that's where they start. It's also an attack on parts of their own healthcare, and that's family planning, preventive services. It also, maternity benefits is one of those essential benefits that you could be waived by states that do that, and it defunds Planned Parenthood. And then one other thing, the Republicans' line is, well, Obamacare is collapsing, it's collapsing, that's why we have to do this. It's not collapsing, but it's getting more problems because of what the Republicans are doing. One reason it already had more problems is the Republicans had cut funds to keep premiums down, and had cut those funds saying they were insurance company bailouts. Well, now the Trump administration, Republicans are not promising to continue funding billions of dollars for insurance companies that keep out-of-pocket costs down. And as long as that's uncertain, premiums are going up even more, and insurance companies, some are leaving the market. And if you look at the statements that insurance companies have made when they say, why are they increasing premiums? A lot of them said, they're going to go up 6% this year, but they're going up 18% because we still don't have a promise from the Trump administration Republicans that they're going to fund these out-of-pocket costs. They're also not marketing it. They're telling people they're not going to enforce the individual mandate. They're doing all sorts of things that are basically, in effect, you don't have to give them the details. They're right now sabotaging it just to justify their wrecking ball. They're raising premiums, having fewer people coverage, and we're seeing for the first time in the Gallup poll that just came out, slight decrease in people covered, because that's what the Trump administration is doing, and then they're blaming, saying it's, oh, we have to fix it, but they're the ones who are wrecking it. Finally, let's talk about solutions and how I would suggest you frame that. And if, President Trump and Republicans really wanted to protect our health care, they would reduce premiums and expand coverage by giving people more options today. And people love options, and they particularly don't love the option of just having for-profit or even non-for-profit health insurance companies. So one is there are provisions in the ACA that make private insurance more affordable, which Republicans have wrecked. They should support them instead. And there's other things we can do. Actually, Alaska just got permission to continue doing one they've been doing it. Other states are going to do it. We can talk about those. And the other, you could offer Medicaid or Medicare alongside private insurance so everyone has a choice. To have a big public plan like Medicaid or Medicare offer, so you don't have to worry about if a insurance company is all abandoned and you won't have a choice. And these plans both are more efficient and less expensive than comparable private insurance plans. If you're in a state, though, you can't affect Medicare, but you can propose that Medicaid coverage be available in your state. That's what the Nevada legislature passed. The governor vetoed it, but it's a great proposal. It'll have tremendous appeal to, it makes tremendous sense. People have a choice. Medicaid is popular. People may say, oh, I prefer private insurance, but at least I'll have Medicaid. Some people will be comfortable with Medicaid. And it allows you to have an active role in solving the problem in your state and not just being reliant on private insurance companies. Some of you may say, what about single payer in my state? It's very, very tough for a state to finance. The former Democratic governor of Vermont really wanted to do this. I met with their staff up there. They really tried to figure it out, but really hard for a state like Vermont that's small. But even in New York and California, where the state legislature, the assembly, and the in both states actually have passed legislation, they haven't actually put the financing in. It's very complicated. And frankly, we kid ourselves if we think in a real political battle, single payer would maintain its popularity for no other reason that what happens with single payer is you're taking employer-based coverage away from everybody. And we go back to loss aversion. So it's an honest, and there are ways around this nationally. If you want to talk about what we should be pushing nationally, I'll be glad to talk about that. That still gets everybody covered, but doesn't have these pitfalls. But if you're in a state, again, focus on Medicaid as an option for everyone in the state, paid on the same sliding scale as private plans in the exchange, or your state can even make it more affordable if you want to spend the money. And finally, I just want to remind that whatever you do in this messaging, healthcare is a right. That's something that people really believe, and they believe government has a responsibility to ensure that people have quality, affordable health care. We're on the highest ground, most comfortable ground we've ever been, and we can stay there and move on, hopefully, to the kind of broad progressive solutions that we'll see if we take a big progressive turn in our country, which I actually think is possible. We can talk about why that's true, too, if you want. Finally, you will get in your, when you get this print out of this, you want to be able to put numbers for your state instead of national numbers. There's uninsured rate in your state, including numbers, not just percentages, federal spending, the percentage loss for Medicaid and the ACA, and the number of actual dollars to your state. In these reports, how much higher premiums and lower tax credits will be for 60-year-olds in your state. In this report, a couple charts on the number of people who will lose employer coverage and the protections against annual and lifetime benefits, and how much more hospitals in your state will pay for compensated care. And there's the website. It's not the website, but the website is ourstoryhub.org. And love to take questions.
Great. We have a question here, and we brought up like the Medicaid for all. I mean, so can you talk a little bit more like how? Is that the same as a public auction? Isn't that a little bit different than a public option? What do you?
Sure.
What's the response to that?
If we're talking, Yeah, if we're talking about a state level, it's a public option, but one way to do it in the state would be to have Medicaid start operating as an option in the state, including in your exchanges, which is where the individual market really is based. So what the legislation in Nevada would have said that if you're on the exchange in Nevada and you want to, you can purchase Medicaid. And you know, at the same sliding scale that you'd get another plan in the exchange, and the Medicaid program would actually be an option. In the original conception, the original legislation for the Affordable Care Act and the version that passed the House, there was a big national public plan that would operate in every exchange. But what a state could do now is say, well, just simply open up Medicaid to everybody in the state as a way of having an alternative to private insurance, and also being sure that insurance companies can't just threaten to leave and blackmail the state because you have no like other insurance company. This would take probably a federal government permission through a 1332 waiver, actually doing, you know, but it puts the federal government on the, you know, put the pressure on them to actually do something. And it's a great discussion to have in your state and shows you're actually thinking about doing something that will solve the problem as opposed to just being blackmailed by insurance companies or say the Republicans are blaming Democrats because Obamacare is not working.
It seems like you've definitely tapped into an interest around this Medicaid conversation. We got a couple other questions. Would doing this Medicaid for all type of conversation, I mean, does the policy piece behind it, does it save costs as compared to a single payer mandate over a period of time? Leanna asked.
Well, so actually, I mean, if you wanted to step back and say we want to have a single payer plan in our state, you could say we'll make Medicaid the single payer plan. You could have a Medicaid system which, if you tried to move single payer, if you wanted a single, so all single payer is one big public plan that's going to cover everybody in your state or everybody in the country. You could say we want to do single payer and we want to make Medicaid that plan. But then you get into all sorts of political problems because people really support Medicaid, but that doesn't mean they feel they want to be on it. And in a lot of states, Medicaid doesn't pay providers as well as it should, which means that there are problems with accessing enough providers. So I wouldn't recommend that as the approach to single payer. Again, I would generally not recommend pushing single payer in the state level. I would recommend saying we can do things to be sure that premiums are more affordable in our state, and for people in the exchanges, we can put Medicaid in as an option so that we know that aren't all people in the exchanges and people in the private insurance market aren't just the only choice is private insurance companies who put their profits before your health and will abandon the state if they can't make enough money. So Medicaid's a great public option, but it's not the same thing as single payer. And again, I generally would think that, you know, I know there's a lot of grassroots support for single payer. I would encourage people to look nationally at a solution for that while doing what you can in your state to be sure that everybody has a choice of a public plan.
I mean, we're having this Medicaid conversation. How important is it to separate Medicaid from versus the Medicare discussion in the context talking against the federal proposal and continuing to fight for Medicaid health care for all?
Well, I mean, Medicaid, I think that, you know, Medicaid is, again, very, very popular in all the ways that you're just saying they're going to slash Medicaid, you're going to radical cuts in it, it's going to blow the whole state budget, you know, families, working families, children. That's a great conversation to have. And what you want to do then in this context, Medicaid is, but Medicare, so Medicare is, as you know, a program, it's a single payer for seniors and people with disabilities. If we're going to be honest, Medicare's got high out-of-pocket costs. It's, you know, it did drug coverage at the last minute in 2003 compared to private insurance, and it's also very expensive. Medicare's got some advantages too, in that it runs much more efficiently, which is where cost savings comes from. It pays providers plenty. Not more than 90% of providers participate in virtually all hospitals, but it doesn't overpay them like a lot of private health insurance, and it doesn't underpay them like sometimes Medicaid does. The thing about for this current debate, though, is Medicaid's the focus, not Medicare. So keep that. But let me tell you what I would do if I were what I think we should be talking about. If you want to talk what should the overall solution be, is we should everybody in this country has quality affordable health care. They could, and the way to do that is to make sure that everybody who wants can have Medicare, or they can keep their employer coverage. And we'll be sure the employer coverage also is affordable, good coverage, affordable premiums, low deductibles. But everybody should have a choice of getting into Medicare. We're going to be sure Medicare is also affordable because it's going to be financed through taxes, not through premiums, and we're going to lower the deductibles. And we're going to get rid of the deductibles, I would actually say, and be sure there's low co-payments. So we're going to have universal health care. We're going to have, no one's going to have to worry about whether they can afford their health care. No one's going to have to worry about their coverage. There will be a national Medicare program which covers everybody in the country who wants to be covered. It'll be affordable. But if you want to keep your employer-based coverage, you can do that. And we're also going to have some rules to be sure that employers can't overcharge you for health care or charge you high deductibles. That's Medicare for all, as opposed to single payer. It will appeal to an activist base, but when you explain it that way, a lot of people will nod their heads. Oh, I never thought of that. And the politics, again, of taking health coverage away from 155 million people in this country of employer coverage, I want to take, so I believe it is possible. If you look at American history, the big progressive eras happened sort of at the darkest times. You know, the New Deal follows the Great Depression, and the progressive era follows the last Gilded Age. You know, we're in the second one now. And for that matter, the Great Society and civil rights and consumer and environmental and women's movements all followed McCarthyism. I think it's really possible that we're at the verge of another era. Also, movements in all those areas, women's suffragette and the labor movement, and lots of other movements. Now we've seen, you know, Fight for 15 and Black Lives Matter and the environmental energy, and so we may be, and now we're seeing the resistance. We need to be thinking about how we create that, how we help that, how you're all leaders and giving a vision for that. And we also have to have policies that we can actually advance and win in that. And so that's why single payer, I may not be realistic, we'll just talk about our base likes it. Our base doesn't really know, except what they really know is they're sick of being the mercy of the private insurance companies. They're sick of having to worry about premiums, deductibles. They're sick of not knowing if they can have coverage. They're all right about that. Which is why, you know, Sanders talked to Medicare for all. We can talk about Medicare for all. Be sure it's affordable, be sure it's quality, and but also be sure that people have employer-based coverage keep that if they like it, and just be sure they can afford it too.
Great. We got a question from Lawrence that gets at one of the pieces missing from this overall debate, and Richard, I need your expertise to help ground this in accurate information. But the Affordable Care Act moved forward, basically hands off the prescription drug piece. Prescription drugs, a major driving cost that's driving up healthcare for a lot of things. Is there value of trying to bring bulk purchasing of prescription drugs into the conversation to put some controls on the cost piece in the context of this conversation? That you're not doing enough to fight the real problem. The real problem is this, and this is about dismantling care for people when we should be focusing on that.
Yeah, I think that's great. I mean, absolutely. You're right that the ACA didn't touch prescription drug prices, because if it had, the drug industry would have spent $200 million, not billion, $200 million at least and advertising, and for a bill that barely squeaked through, that probably would have killed it. So, but living to fight another day, absolutely. I mean, the American people, drug corporations, and I'm calling corporations, not companies, on purpose, because we've done some research that shows that sharpens it. Reminds people these are big for-profit making corporations. Drug corporations and insurance corporations, incredibly important, unpopular. Drug corporations, much more so now because of all the high prices for life-saving drugs that they charge all the time, all the rip-offs. And it's totally, people totally get that these are, that, you know, we should have our government using its purchasing power through Medicare, through Medicaid, through other ways, insist that we get good prices and lower the prices of different drugs so we can afford it. That's what we should be doing. That's what every other country does. It's what the Veterans Administration does. They get lower prices because there are purchasing lots of drugs, and let's use our bulk purchasing together to lower the cost. Just as the first person who's on the phone who you asked so eloquently said. So great issue to bring up, great issue to keep hammering. And, you know, as I said before, the president actually said that, but he's not doing it. He's doing something called values pricing, which is actually going to be a gift to the returns to the drug corporations.
Right. In the conversation we were talking about Medicaid for All, allowing people to buy into the state Medicaid program. Why isn't there a conversation around buying into the Medicare program?
Well, you could, yes. So the main thing there is that your state can't do that on its own. I mean, I think that would be a great thing for the federal government to do. I mean, what I've written some, you know, like opinion pieces, like, you know, that a good thing for Democratic Congress, Democratic president to do would be to open up Medicare, make it the public option at every exchange in the country. It's the same thing really with state we do with Medicaid, but it's just because Medicare would need restructuring. Remember, Medicare only doesn't serve anybody under 65, so it doesn't have pediatric services. Medicare is actually as much higher out-of-pocket costs than the basic plans and the exchanges right now. So you'd have to make a bunch of changes for Medicare to actually have it function, and you'd have to do that nationally. You couldn't do it at the state level.
Got it. That makes sense. If you weed through some of these questions. Do you have, can you point people in the direction of any resources that would make a conservative case for Medicaid for All? It's Leanna again.
Well, I mean, I don't know of any resources that would make a conservative case. I guess I'd like to know what your the person calling in would make a conservative case. I mean, I guess the one thing that comes to mind is to make the argument that choice and competition, which is particularly the competition is a conservative frame, and that right now one of the problems is that the private insurance companies have no competitors, so they're able to charge, basically blackmail the state and say, if you don't give me more money, I'm gonna leave. So if you had the government saying we're going to offer a competition with the private with the private insurance companies, if there's a choice, that's the argument I make. I mean, the problem is, conservatives don't like to expand government, which is why the passage of the ACA was like the biggest slap in the face to them possible, because they've been on this, decades-long tear, which they've been doing very well on, to weaken the government and to have the biggest government expansion in 45 years. It's a big reason why they have so relentlessly worked to discredit, and why they're so frustrated that repeal's so unpopular. I mean, when their analysis was, if in 2014, if they couldn't stop the ACA from being implemented, that people would become dependent on it, right? Which is to say, government actually would work for people, and they say, yeah, that's good. And it turns out they were right.
It's working, yeah. I mean, I think along this line, and maybe I offer some information to anyone, frankly, that there is public data of what the average costs per someone on a Medicaid system is. They generally have it broken out: cost per children, cost per adults, cost for I mean, other groups that might be segmented. And so, I mean, to Richard's point about being able to say, listen, if I mean the private sector is not going to play in this space, we're going to put we're going to compete in the market to get a product that works for people, priced at what we already know what we're paying for folks. So I think in terms of getting actual raw numbers and what this looks, and especially to put in the cost comparison to what people are paying for plans, if it would be a plan that would, I think similar to that, what the hope of the Nevada plan was, like to allow it to be on the exchange, be eligible for what all the appropriate subsidies would be, and can be the provider, if you will, is an interesting way of throwing it out there. Because I think the other question that that you raise is Medicaid for all and a lot of these other things. The Medicaid costs keep going up, and it's sucking up state budgets. It's putting it's one of the fastest growing sector of state budgets. My question now, to you, Richard, is like, how do you address that? So Medicaid expansion was a result of a massive infusion of dollars to states that supported the Medicaid expansion. That comes with a cost sharing of a certain amount over. That will be phasing in actually fairly soon. Conservatives keep saying this is blowing up our budgets. This is blowing up our budgets. We can't do this anymore. Advocating to reduce those Medicaid contributions to the states. How do we make the press of why this is and why it's important and why it's working?
So first of all, the Medicaid expansion saves states money, and there's tons of studies that show that when you look at the decrease in cost of uncompensated care to hospitals, or people showing up at the hospitals who need coverage and don't have any insurance, and the cost of the state to that, and the cost of keeping hospital whole on that, is that Medicaid expansion saves states money. Remember, the federal government started by paying 100%, and the lowest they're going to get to is 90%, assuming that the Republican plan doesn't pass, which would basically make the rate go down to the regular Medicaid rate, which then would cost the state a lot of money. So first thing, it's not true. Medicaid expansion is actually saving the state money. It's also saving, and one of the reasons it's doing that is people are not ending up in the hospital without insurance. They're less likely to end up in the hospital because they're more likely to take their drugs, to get preventive care, to be less sick. And you know what? We're going to pay for something. Let's pay for an ounce of prevention, not a pound of cure. And as opposed to we're going to get compassion to the point that someone is so sick that they end up in the emergency room or end up with advanced cancer. So that's the main argument I'd make without getting into all the data. Generally, though, of course, yes, Medicaid is a big share of the state budgets, and the reason, so yeah, Republican plans are going to way cut back the amount of money states have, make it much worse. That's what, but yeah, we do need to move nationally towards a healthcare system that's more affordable, and that means getting everybody covered and being sure we're not overpaying insurance companies, we're not overpaying doctors, we're not overpaying drug companies, we're not overpaying big medical device manufacturers, which is we do in this country, and overpaying medical specialists. Preventive primary care doctors aren't overpaid, but the orthopedist whose average income is like $450,000 doesn't need to make that much. But if you're just talking the more popular with the public is overpaying drug companies and medical device manufacturers and wasting a ton of money on administrative costs and insurance company denials and everything else. Those are ways we can save money. It's also true that some states are doing a better job. And so in a more serious, really serious, less messagey, but policy angle, there are states that are doing a better job of running their Medicaid programs by focusing on prevention, by focusing on primary care, by doing big managed care programs for the most expensive people, which are your mentally ill, your homeless, where there's an enormous overlap, by people with serious chronic conditions. That's where the bulk of your costs are. And if you have a serious program of providing good care coordination, good support for those people. If you invest in that in your state, you're going to be able to save money in your Medicaid program as well as improve people's health. And there are states that are doing that. And actually, so learning more about those and how to do that, and providing the right incentives in your Medicaid system for that, is a way to control the costs of Medicaid, where the costs are being most driven by the sickest people, and to lower the impact on your state budget.
I have another, it was more of a comment that's trying to get to the conservative case, or at least a market-based case. So when we talk about Medicaid, and frankly, any rollback of Medicaid, when you take into consideration the economic power of those resources, I mean, it's not like the money's sitting in a bank somewhere. It's flowing into hospitals and it's paying people's salaries. It's flowing into doctor offices, lab offices, and the entire healthcare complex. And so it would seem to me that there's an argument to be said that our state will lose sizable economic activity if you contract on this. I mean, I don't know. I mean, I guess it depends on what audience you're talking about. But it does, I mean, bring up this other question. And I realize that virtually every healthcare association, agency, etc., has opposed what's been coming out or being proposed. But I certainly don't hear them opposing at the volume that many were when they were pushing the ACA. Speaking out in support of. And so I guess like their opposition to destruction seems to be quieter than their vocal public support for. Or is that just because I'm in a state with 2 senators that have come out, I mean, overwhelmingly against destruction of the ACA?
The first point is absolutely right. The impact on jobs, the impact on the state's economy, the impact on hospitals and communities, on economic activity in the state, these cutbacks to Medicaid will be an enormous, enormous negative impact on your state's economy. Absolutely right. And then in terms of like hospitals particularly weighing in against the Republican plan, what I observed is that, I mean, so these are big organizations that hate to use political capital, hate to alienate anyone, and hate to take any risk. And so they were keeping all their opposition, and this is true of actually Republican governors too, they were keeping their opposition really muted throughout the House debate, which was terrible. And leading up to the Senate introducing its legislation. And I realized what they were hoping for is that the Senate Republicans would somehow not do such awful things, that they would understand that. And there was all talk about the Senate's going to do something different, the Senate's going to do something different. When the Senate didn't do anything differently, in a lot of ways they made it worse, particularly on the long-term cuts to Medicaid, they made them even deeper. All these groups started going, oh shit, they're serious. And so we saw a lot more pressure from particularly the hospitals and then governors who I think sort of looked at the state budget, and including Republican governors, starting at the end of last month when the Republican Senate bill was analyzed by CBO and revealed. Still, though, having said that, you're right on in terms of they were cowardly, and the main pressure has come from the enormous organizing and resistance. A lot of it spontaneous from people, including a lot of really conservative people, who are like, this is going to really wreck my business, wreck my farm, wreck my family. This is not what I voted for.
Right. Got another question here that kind of speaks to, I mean, with Medicaid being such a focal point of this debate, that we don't hear so much about the impact of Medicaid as it relates to nursing home care and a whole bunch of critical care for poor people who otherwise wouldn't be able to afford that care. Can you, I mean... Yeah, well,
obviously, I think, and I've done this in these slides, I think it's really important to be talking about all the people at Guts that we're talking about you know, huge attack on long-term care for seniors and people with disabilities. That, you know, it's an enormous cutback on women's health, and, you know, we're talking about half the pregnancies are women paid for by Medicaid. So those are low-income women, obviously, whose pregnancies are being paid for by Medicaid. We're talking about 30 million low-income children. So, I mean, people think of Medicaid as a program for poor people. They actually may not understand that Medicaid actually is the biggest funder of long-term care in the country. Although, if they have older parents or they have disabled adults in their families, they certainly know that. But I agree that these are points we should be making over and over again and reinforcing.
Right. And I think I've covered everything that's been raised here. If people have additional questions, feel free to raise your hand, and if you have audio capability, we can unmute you, or type a few other questions in for Richard, who's really been on the front line here, and to see if there are any. I mean, while we have Richard here, any questions that folks have. While people are doing that or thinking about that, as Richard pointed out, that I learned a new little tool that I can actually add handouts during the course of the presentation, and was able to add the slideshow deck that Richard went through in the course of the presentations. That should be on your control panel. You can download that, and if you're not able to download or you're in a place where you can't, we are happy to get that over to you. So the links that Richard referenced to be able to get state-specific data is captured in there, so feel free to do that as well. But since I don't see any other questions coming and no hands going up, Richard, I'll give you the final word. I think this has been incredibly helpful to, again, bring into context like what we're up against, and more importantly, to concluding with leading with what we can be saying, what we can be talking for, what we can be advocating for, building on all the organizing that got us the largest expansion in healthcare since the creation of Medicare, frankly, and a framework on how to talk about this, and it's probably now more than ever needed to protect healthcare for the 20+ million people who are at risk of losing it. So, Richard, I'll give you the final word.
Oh, final word? That's like, well, that would seem like a great final word, Dave. Thanks a lot. And you know, we actually are in. I don't know if we're. I guess the one other thought I'll leave is, I don't know if they're going to get this done. They're desperate to get it done, but even if they get it done, it's not over, because all the effective dates in this legislation are like 2020, 2021. This issue isn't going away, but we can stop this in the Senate in the next 3 weeks, and the fact that that's possible is really remarkable, and we should all just take tremendous joy in the resistance that people have put up in how they've raised their voices, and also how people really want to move beyond this to something even providing more security for their families.
Right. Well, great. Thank you, everyone. Please download the presentation, use it, share it with the best practices and the message points that we lifted up in here. And again, Richard, thank you as always. It's great to have you with everyone joining us around the country. It's glad to consider you a friend and a resource to help support all the work that I do. Don't be a stranger. Join us again for a future session.
Glad to do it. Thanks, Dave.
All right. Have a good one, everyone.